We're still waiting for a few more students. Vanessa, I saw you come in. We're just waiting for 2 more. But I'll get going so we don't waste any time here. So welcome to week 6. Wow. By the end of this week, we're going to be halfway through this term. It's hard to believe. Everything is going so quickly. How's everybody doing? Do you feel like it's midterm already?
Yes.
Everybody keeping up? The calendars are full of due dates and assignments and exam reviews and exams, right?
Mhm.
Yeah. So this is exam 2 prep week, right? I haven't touched base with Professor Ford this morning. I know she had her review this morning. Did anybody attend?
I didn't attend, but I watched it.
Oh, you did?
Mhm.
Well, I don't have the recording yet. So I have to wait for the recording from her and the attendance. So there's 2 more exam reviews this week. You can go back to week 1 and look at your master schedule. I do one Friday after my afternoon class, so I think it would be at 6 p.m. Eastern. And then Professor Kershaw will do hers Sunday evening at 6 p.m. Eastern. So there's still 2 more live reviews you can go to. And then, of course, like exam 1, you'll have all the recordings. So if you can't get to a live review, I would highly suggest you review the recordings. And then you'll be taking your exam a week from today. So next weekend, if anybody, or even this week, towards the end of the week, if you are having any issues with understanding concepts, right? Because you'll have had class today and we're doing week 6 content or concepts. So after today, you'll have all 3 weeks to study for, right? So if you have any issues after you're preparing or during your preparation, please reach out to me, okay? If you need to go through anything. All righty. What else was my week 6 announcement? Oh, there were, I think I mentioned this in my announcement, there were a lot of missed math questions for PN students in general. And I saw this firsthand as I was doing quite a bit of exam reviews with students from exam 1. So if you missed math questions, I would highly suggest you prep, because these math questions are simple. Okay, you should be able to figure out these math questions. Calculations per hour, drip rate. And so in week 1, I sent you a very extensive announcement with math resources. Okay, so please go back and look at those resources. If you have to prioritize, I would prioritize the math resource from Professor Bogart. Okay, she's the PEDS instructor. Some of you may have her. I would prioritize watching her tutorial. It's a YouTube channel, and she does a real basic math review. The other resource I sent you was Dean Brown. She did a very basic math review a couple of terms ago with a lot of students. So I would suggest you watch that. Okay. And then remember, you have your Calculating with Confidence book in your student resources. Okay. You really shouldn't be missing math questions, not these ones. Okay. It's just leaving exam points on the table. No need. So you can also reach out to your campus. Many campuses have tutors, math tutors, or math tutoring sessions. So reach out as well. Go ahead, Charmaine.
For St. Lucie campus, our Professor Miller is starting back on
Fantastic.
Zoom tutoring for math this week.
Okay. So everybody from Port St. Lucie, make note of that. if you need some assistance with math. Okay. The other thing I noticed, and we'll take the quiz here in a minute. The other thing I noticed with all my exam reviews was going too quickly. There's a couple things I picked up on. Going too quickly, reading questions too quickly, and not picking up key words or cues in the question. Right. So I think I've already gone through my suggestion is the first time around, you're highlighting important words, phrases, and then you're also eliminating answers with that eyeball. So the second time around, hopefully the question's more focused. Okay. So I noticed that was one of my observations is going way too quickly. The other observation was overthinking, adding information into the question that is not there. Okay, so please remember, you only need the information in the question to pick the correct answer. Don't be adding your thoughts into the question. Okay, so those math, reading too fast or not reviewing the question a couple of times, and what did I just say for the third thing? Oh, overthinking. Okay, so those are my tips from the many reviews I do with students. Alrighty, so today we're going to take quiz, I think we're up to quiz 4 now. Okay, and then it is 3:06, 15 minutes. A couple of students have accommodations, have a couple of extra minutes. So we'll take quiz 4 and then we will review it. And then we will cover, well, I'll do a lot of content teaching from the quiz like I always do, and then we'll cover any additional content. Occupational health, environmental health, barriers to learning, and reinforcing health education are concepts we'll cover this week. And then you have a case study. I sent a case study in the announcement. Okay, then we're going to break out like we did in week 3, break out into groups, 3 groups in the breakout rooms, and you'll each have a question, each group. Then we'll come back and talk about it. Okay, that's the plan. How does that sound? Okay, and remember, is it next week? No, 2 weeks from today, Memorial Day, we do not have class. No class. There's no makeup class, right? Remember, this is a class that we add on 10 minutes after every class so that it is built in that we make up the Memorial Day. So everybody make note of that. No Memorial Day classes. All right?
I have a question.
Yeah, you bet.
So we're supposed to have a quiz on Memorial Day and that's being canceled. So when will we take that quiz?
The next week.
So we'll have 2 quizzes that week?
Let me good question. Yeah, we do have a
See.
yeah, I'd have to look at, you know what, let me look at the calendar. Yes, we do have a quiz that. We would be taking
Quiz 5.
quiz 5 in week 8.
Okay.
We
So
only
we-
have, yeah, we it wouldn't be 2 quizzes. We only have 1 quiz left after today.
Okay, so Memorial Day was quiz 5. Okay, so the following week we
Yeah.
would just take that one quiz.
Yeah.
Okay, I see that.
Yep, yeah. We won't have 2 quizzes together. No, that will be your last quiz, actually.
All right, my other 2 classes have exams that following week, so that I think that's why I was confused. Okay.
No worries. So yeah, we'll take the quiz the Monday after Memorial Day. Alrighty. Okay, so everybody stay on camera for your quiz. As you know, it's 3:10, so we will come back at 3:30. Everybody's got to be back by 3:30. Take your time with the quiz. It should be up and ready for you to go. The passcode is my last name, which I will put in the chat. Okay, so go ahead and start that. I'm going to mute myself and I'll make sure everybody else is muted. I wouldn't don't log off. Just if you want to turn your camera off while everybody's finishing, that's fine, but don't log off. Okay? So go ahead and get started. Looks like everybody's done. So if you could start coming back on, that'd be great. The other thing I forgot to mention in my housekeeping updates was I sent you an announcement this morning. I turned the homework grades on today. Everybody see that announcement? So that should be happening in all your classes this week. This should be on today. Those homework grades are on for this week and most of next week. Okay. So homework grades are turned on so that you can see how your overall homework is affecting your current KGA. So it should already be, so the grade you see right now in the grade book is with homework. Okay, but remember, the homework does, oops. Remember, the homework doesn't get added in at the end of the term unless your KGA is above 78. You all know that. That's your 3 exams, your 5 quizzes, and your HESI. Okay, and looking at this class, there's some students that have homework issues. And so their grade is being brought down by either missing assignments or lower grades in the assignment that you turned in. Okay, so what you're looking at now is your overall grade. Okay, and this is to help. We turn that on in week 6 and 7 because we know that week 8 is a drop week. Not that I'm encouraging anybody to drop. I never do that, but just for your information. And then at the end of this week, if anybody is below a 78 KGA, I have to complete what's called a mid-module assessment. Okay, and it just summarizes where you're at, what assignments are missing, what's late, and it asks you to contact me for a one-on-one midterm assessment, midterm meeting. Okay, and you got to follow through with that. And those, like the at-risk reports, go to your deans as well. Okay, I forgot to mention that. So if you see your grade is higher or lower than what you were looking at yesterday, that's because homework is on. All right. All right. I'm going to go ahead and share my screen. How'd you do in the quiz? Good.
Good.
All right. Let's go through it. All right. Pardon me. Can everybody see my screen?
Yes.
All right. Thanks. Okay. All right. So these questions are a mixture of occupational health, environmental health, teaching, learning, barriers to learning. Okay. So what statement is true regarding children and environmental health hazards? What's the correct answer?
B.
Okay. Why is it B? Anybody can jump in. Okay. Let's all talk about the quiz. Why is B correct?
Because they're more lower to the ground, so they're more, like susceptible of putting things in their mouth.
Exactly. Exactly. We know that A is incorrect, right? Ineffective is more ineffective at eliminating toxic chemicals. We know that C is incorrect. We know that D is incorrect. So if this were an exam question and you did your 2 steps, you're highlighting environmental health hazards and kids. That's the important information from this question. And if you used your eyeball to start crossing out answers, you could cross out A, C, and D because we know they're all those 3 incorrect, right? So that leaves you with one option. There's your correct answer. Okay. During a home health visit for a pregnant client, the nurse notes that the client's husband regularly uses pesticides at work. Which nursing intervention is a priority? So priority is the important word here. Okay, well, a couple of things. Pregnant, client, pesticides. So which intervention is a priority? This is a question that if you look at it, maybe there's more than one answer that looks correct, but it's not a select all that apply. So you go back and reread the question. Maybe you were, if you got this wrong, and maybe you missed the word priority. Okay, so we need to be thinking big picture. What risk do pesticides, what's the highest risk pesticides will pose to a pregnant client? So what's the correct answer?
A.
A?
Mhm.
Anybody get this question wrong? Okay, why is A correct?
Because you're trying to prevent the pregnant woman from coming in contact with being exposed to the pesticides that could
Mhm.
cause neurological effects for a baby.
A lot of students sometimes select B as well, right? Which is actually a correct answer, right? But it's not the priority. So if he selected B, you might have missed the word priority. A is the priority, but B we still want to recommend. C, maybe. D, maybe. So, but what's the priority? We want him to remove before coming in the house. Okay, so there's a really good example of a question that more than one answer looks correct. Could be correct. Okay, the home health nurse works in a community with high rates of complex chronic illnesses and neurological disorders. This is an environmental health question. Which environmental characteristic would be a priority? Again, priority is the word here.
C.
Pardon me?
C.
C.
C. Why is C the priority? Why is C the priority?
Because of the manufacturing plants
Yes.
near the water.
That's one of the big risks of environmental health is what kind of community you live in. We know that B is incorrect. Why is B incorrect?
Because of the 1992,
1992.
should be older than 1992,
Right.
1978.
1978 is the cutoff, right? Okay. Okay, now we're getting into some questions about learning and reinforcing health education. So the nurse is reinforcing education about the diabetic client. Which statement indicates a barrier to learning? So before we answer this, what kind of question is this? Is it a positively framed question or a negatively framed question?
Negative.
Negative.
Why? Why is it negative? What are we asking about the client statement?
You want basically what would be considered like the wrong answer.
Get
Right.
answer.
Right. So which client, and there were several students who missed negatively framed questions on exam 1. This is a negatively framed question. You have to be able to tell the difference of a positive and a negative. Right. So what are they saying that indicates they have a barrier to learning? So what are they saying that's incorrect? They need more education, they need more reinforcement.
D.
Why is D the correct answer?
Because D is probably, he's thinking that the foods are better. He can eat more foods than what she wants to give him as a diabetic. He's not gonna get the foods that he
Right.
he likes or he's usually eating.
He's kind of making up his own mind of what he wants to eat, right? So everybody understand why that's a negatively framed question. And another negatively framed question, you're teaching a parent who smokes about the risks of respiratory illnesses with their child with asthma. What does the parent say that indicates they need re-education or additional information? So you're looking for a wrong answer, right?
Yes.
Okay. Okay. Which nursing intervention will enhance the learning for a client who speaks English as a second language? What's the correct answer? I would like B. Why is that correct, Brian?
Because if you create a pamphlet in the client's primary language, they have a better understanding of it. English is their secondary language, not their first language.
Yep, absolutely. And all these other answers don't indicate that we're providing information in their primary language, right? And that's what we'll talk about when we get into barriers to learning, reinforcing health education is trying to provide information. In this case, it's a pamphlet, but in other cases, it might be flyers in their primary language, seminars or teaching programs in their primary language, right? If we're providing a recording of the teaching to later view, if it's not in their primary language, it's not going to make a difference, right? The other important piece of information about, what's the important piece of information about why C won't work? Or potentially might not work.
Their language, first language probably is the same as hers, and they don't understand either.
Okay. Anybody else want to add to that?
They might not understand medical terminology, so they'll probably be translating the wrong information.
Exactly. Right. I mean, it's always the primary. We'll talk about this when we talk a little bit more content. It's, I mean, primary, to find an interpreter is the best solution. Right. Because C, think about it. Like Mariah just said, we don't know how much understanding the family has either. They may be able to speak English or part of English, but how can we assess their comprehension? Right? And of course, we wouldn't do D. Okay, question 6. Home health nurses reinforcing education on the use of a glucometer. Which approach would be most effective? Most, that's the important word here.
A.
Because, why is A? What is that called? What is A called?
Teach back.
Teach back. That's the best way. This is what I would do in the schools all the time, teaching kids how to give their insulin pump dose or give their insulin shot or check their blood sugar. Right? You demonstrate for them and they demonstrate back to you. Okay. And because it says most effective, I mean, B, you could do that. C, you could do that. D, you could do that. Okay, so any of these answers could be correct. However, which would be most effective? That's that teach back. Okay. 7. Home health nurses reinforcing education with an 8-year-old client with type 1 diabetes. Which approach will be most effective? Similar question to the last one.
A. because it gives them the chance to practice with their toys or their dolls to make sure they know like the process they'll be doing for themselves.
Exactly. Did that a lot in the schools as well with the younger kids who really did want to check their blood sugar, learn how to do a finger stick, right? Have them practice hands on. Okay, obviously kids at this age, B is incorrect. They can't handle comprehensive sessions. And if the child is expressing, I know 8 seems young, but 8-year-olds are capable of taking care of their diabetes, at least in the school setting with assistance, right? We don't want to just teach the parents rather than the child. We want to include the child. And kids at that age we're not going to teach with written pamphlets. Which nursing intervention is a priority for a client who's not motivated to learn? Motivation is a big issue with teaching. Okay, so it's asking what is the priority for somebody who does not want to learn? What's the right answer?
D.
What did you say?
D.
D as in dog.
Yes.
Okay, really important to establish trust and rapport prior to attempting education. Why do you think that's important?
So that they'll trust you and
They may be more engaged to listen. Again, my experience in the schools, working with kids, working with parents, it is always critical to establish some kind of trust and rapport when you're trying to teach them. Okay, A wouldn't be appropriate. I mean, B, maybe. Not, I mean, if there's a lot of if you've already established trust and rapport and there's still a lot of pushback, you could ask B. Okay. Okay, question 9. The occupational health nurse is caring for a client who reports lower back pain. It's worse at the end of the day. Which nursing intervention is a priority?
B.
Right. We'll talk about that when we talk about occupational health nursing. Part of the occupational health nurse's responsibility is to assess would be to assess lifting techniques. If this is somebody in a position that's lifting all day and they're complaining specifically of lower back pain at the end of the workday, we would assess to make sure they're doing things right. Right? We certainly wouldn't do A. Okay, we're not in a position to treat, right? As nurses. So we wouldn't be recommending that. And again, we wouldn't do C because we're not treating. And we don't need a referral for a medical evaluation yet. Right? The question is asking what's a priority? We would assist their lifting techniques and body mechanics. Right? Last question. Which statement is true regarding scheduling of client education? Do we want to do it on our terms or their terms?
Their terms.
Their terms. Right? So B is the correct answer. A is incorrect. C, not necessarily. Depending on what their learning style needs are, it may take several sessions. And D is inappropriate. Okay. So here's our PowerPoint for this week. Okay. Occupational health, environmental health, barriers to learning, reinforcing health education. So take some notes. Okay. So let's talk about occupational health first. What does an occupational health nurse do? There was I didn't. I will send that to you. I have a video of occupational health nursing. I don't think I included that in the announcement. I'll include that for you. Or actually, it might be, hang on. Let me look. Yeah, you have a Canvas reading, right? You have book reading, right? But you also have Canvas reading this week. And your Canvas reading is about environmental and occupational health. And there's some videos in there. That's where the videos are. Anybody have a chance to look at them? So what does an occupational health nurse do? What is their primary focus?
Assessing the safety in the workplace.
Okay, that's one thing they do. What else do they do? I'd like others to chime in as well, please.
Assess patient that have maybe injuries.
Okay, yeah. What else do? They do a lot. Occupational health nurses is an extremely important part of the healthcare team in the workplace.
Case management.
They do case management. So if somebody gets hurt, there's a lot to do. We'll talk about that in a second. Okay, so they're responsible for the health and safety of employees in the workplace. And that's everywhere. That could be in a big hospital setting, could be in a long-term care facility, in any work setting. Could be a fast food, could be a bank, could be any work setting. Okay, all work settings have compliance, health and safety compliance laws, guidelines. And that's OSHA, right? Occupational Safety and Health Administration. OSHA is responsible for putting in place all the guidelines, all the issues for the workplace. And it looks different in every workplace. But no workplace is safe from risks. Right? If you think of a hospital, think about all the workplace safety issues there could be. If you work in a fast food restaurant, think of all the safety and health issues, risks there is. Right? Usually in larger facilities, there are departments, occupational health department. Okay? In smaller areas or smaller businesses, they may contract with the occupational health nurse. But somebody is responsible for making sure this is all being complied with. Okay, so if you think about a big hospital, think about all the job descriptions in a hospital. Food service, transport, environmental services, CNAs, nurses, OR techs, physicians, lab, radiology. Everybody's got a different job description, right? That occupational health nurse or occupational department is responsible for making sure they understand what's in all these job descriptions and what each employee in those areas, what their job description is about, what are their risks. What if you're working in the OR and you're dealing with chemicals? What if you're working in the transport department and have to do the lifting? Okay. So that occupational nurse needs to know job descriptions, how people are performing, what materials are around the facility or the restaurant. What are the job requirements? Okay, what are the potential hazards in the job? Okay, what about the work practices of the employee? That's where we look at trying to prevent work injuries. The goal is to keep people at work functioning at 100% capacity. All right, so if you have employees that are getting injured on the job, or maybe they have a chronic illness, let's say diabetes, for example, and they miss a lot of work, is that due to the way they're caring for themselves? Can the occupational nurse step in and help provide education? If it is diabetes related, have they run out of supplies? Are they not managing their diabetes? This isn't just a physical injury like a back injury. Because if you think about, we spend 1/3 of our life at work. Everybody's bringing things into the workplace, whether it's a chronic illness, maybe a mental illness or diagnoses. Maybe they're coming back from an injury. Maybe they've been recently diagnosed, they've had an accident over the weekend, like for the kids in school. Maybe they were at the hospital over the weekend with an asthma exacerbation. And they're coming back to school on Monday with new restrictions or new guidelines for how it's managed in the school. The other thing in occupational health, and I think I already said, no job is safe. Okay, there's always risks in every place. The occupational nurse also does safety education, right? Safety education, think about when you get hired for a new job. You are trained in all the areas of risk, right? If you're working, let's say you're an occupational nurse in a plant, maybe a automotive plant that has heavy equipment, or maybe agriculture, heavy equipment on farms. Okay, what do people need to know to safely operate this equipment? What education do they need to know about their job? Okay, we talked about nurses see various injuries and diseases acquired from employment. Okay, every single industry has serious hazards related to work. No work is completely risk-free. Okay, so here are some of the roles of the occupational nurse. Clinical educators. Occupational nurses are always educating. This is who typically is part of your orientation with a new job. Okay, so they're always educating on workplace safety. Case managers. Case management is simply the coordination of care. So occupational nurses really function as case managers when there's an issue. Let's say you've had an injury at work. They're going to be working with all the team members involved. It could be the physician who is under the care, who is providing care to the injured client. They're working with human resources about leave. They're working with maybe physical therapy about returning to work, maybe on limited duty. They are getting updates of how therapy is going, right? So they're involved with when can they safely return to work? And if they safely can return to work, do they have to have modifications? Does all that make sense? There's a lot included in all of that. We talked about mental health. A lot of people bring their mental health diagnoses and issues to work. So occupational health nurses also may be providing counseling, maybe even some crisis intervention. A lot of big organizations have the EAP programs, the employee assistance programs, that if you're struggling or have a child that's struggling or a spouse, you can reach out to them for support. But there's a lot of think about all the workplace violence that's increased over the years. Right? One of the goals of the occupational health nurse is health promotion and risk reduction. In our large school district of 90,000 students, we actually had a health and wellness department. It included occupational nursing as well. They did a lot of education, seminars, programs for health promotion, healthy lifestyles, balancing work and personal, smoking cessation, weight loss, right? So the more primary education we can provide in the work setting, the risk, there's some risk reduction in maybe conditions, future conditions. Okay, and the legal and regulatory compliance I was talking about was that OSHA. There are guidelines that everybody has to follow. So let's say in the hospital, let's say there's a unforeseen death in the OR or in the hospital. OSHA will visit that hospital. Let's say staff members were burned working at a McDonald's. Okay, OSHA will visit that site to see what went wrong. Okay, so occupational nurse, worker and workplace hazard detection. That occupational nurse has to be aware of the risks of the worker. I mean, let's say you work in a large, noisy plant. Do the employees have ear protection? Do they have eye protection? You have that nurse is responsible for making sure the employee has all the tools to successfully carry out their job description. And so you can see why occupational nursing is a really important person on that healthcare team, right? Because your goal is to have people at work functioning to their best capacity. Okay, so here's a couple of examples of primary, secondary, and tertiary with regards to occupational health. So maybe you're preventatively trying to teach some coping mechanisms, right? Providing information on a healthy diet education, educating on use of proper lifting, use of personal protective gear. That's all primary, trying to prevent any accidents before they happen or injuries. Secondary, screening. Talked about that large, noisy plant. Maybe there's annual screening for hearing loss. Let's say you have several people with chronic diseases, maybe hypertension. Maybe you're doing annual blood pressure checks. Screening for stress and burnout for those people that may be really stressed out at work. How do you screen for risk there? If their stress or burnout is not under control, you're going to get less productivity. So how do they screen for workers that might be at risk for stress and burnout? And then tertiary, something's already going on. Somebody has a condition, they've already been injured. Maybe the occupational health nurse is working with that client on coming back on limited duty as they're recovering from their illness. Right? Let's say another example here is, let's say they had surgery for carpal tunnel. It's up to the occupational health nurse to make sure they're wearing their braces. Right? Or wearing their splints. What if somebody's had back surgery? And the discharge instructions say at work they need to be wearing their back brace. It's up to the nurse to ensure that they are following the guidelines, the discharge guidelines, or re-entry into the work. Okay. Questions about environmental health or occupational health. Really important role for that nurse. She plays a big part in ensuring a safe work environment. Just double check my notes, make sure I covered everything. Talked about she performs lots of different services. Environmental health. Think about it. Think about the community where you live in. Think about all the environmental risk factors. Right? I'll use my community. I live near a big big, loud highway. I-70, it goes from the West Coast to the East Coast. I can hear the trucks putting on their brakes coming down the hill. I can smell their brakes. So for me, in the community I live in Denver, air pollution, noise. Okay? But think about all the environmental risks in all of our communities. Do you live near a transportation hub? Like me, a big highway, an airport? Do you live in an agricultural community? Do you live in an industrial community, near a waste site, a dump? Do you live in a community that has poor living conditions, crowded housing? Go back to agriculture, pesticide, spraying, over. Do you live near noisy plants? I mean, think about it. In your communities, I'm just curious, in your communities, what are your risks? Do you live near waterways? The potential for contaminated water. The biggest environmental polluters we talk about within this class are air, water, soil, and food. I take for granted, if I go to a fast food restaurant or go out to dinner, I take for granted that people working in that facility are following the correct protocols. Storing food at the right temperature, preparing food adequately, using good hand washing, right? Because one of the big environmental risks is food poisoning, air pollution, water contamination, contaminated soil. Let's say they build a new housing project or residential area on contaminated soil. I live near a previous nuclear power plant, maybe 10 miles away. The city's been fighting to build around that land forever, and the soil is contaminated. They will not build. Okay. What risks are in your community? Nobody has any risks in your community? What about the pesticides you have around your house? Pesticides in work buildings, pesticides in schools, cleaning materials. Think of all the toxic stuff you have around your house. Right? We know that environmental hazards are responsible for half of the burden of disease, right? Environmental hazards contribute 80% of all the communicable and non-communicable diseases. Children more vulnerable to environmental hazards. That was one of your quiz questions. Environmental health determined by several things: genetics, socioeconomic status, living in poverty versus non-living in poverty. Environmental exposures, we talked about that. Okay. So if you're doing your environmental assessment as your home health nurse, or let's say you're the community nurse, you're doing the environment, what you're walking into a community from the get-go, and you're doing an environmental assessment. What are some of the things you're going to look at? Where do people live? What do they eat? I don't know. Do they live near rivers or streams? And what's their dietary history? Do they eat a lot of fish? High levels of mercury. Where do they live? Do they live in crowded housing conditions? Remember, we talked about this in the migrant community. Living in crowded housing conditions add additional risks. Do you live in an older community? Do your kids go to an older school or daycare that potentially has exposures to lead-based paint? Pesticides, drinking water, air quality. Do you guys think about these things on a regular basis? I just take for granted that the air quality is good, the water is healthy, the soil is not contaminated, the food is properly prepared. But we shouldn't take that for granted. We know that with regards to environmental health in kids, kids are more sensitive. Childhood cancers are on the rise. Okay, we know that they have underdeveloped livers, immunocompromised, breathe faster, consume more food, water by body weight. Okay, so kids are much more at risk to environmental exposures. Okay, we talked about food, contaminants, different kinds of bacteria or outbreaks you can get, teaching good food handling practices. Okay. Lead-based paint, we talked about pesticides. It's estimated that 30 million Americans drink water that does not meet the EPA standards for safe drinking water. And EPA is the Environmental Protection Agency. Okay. They are the federal agency that monitors environmental health, environmental risks. You can actually go on the EPA website, plug in your zip code, and it will shoot you back a list of environmental risk factors within your zip code. Okay. Okay. Questions about environmental health? Just think about it. I'm just curious. I'm going to stop sharing for a minute. What environmental risks are in your community that you worry about?
Personally, for me, probably like pesticides, just because I do live by like orange groves or farms, and they do tend to spray
Mhm.
them a lot for work. So that's what I would think. I also live by a
Pesticides.
school as well.
Yeah. Yeah. What else? Does
Also,
anybody live near an industrial site?
but we've been having ongoing issues with contaminated water.
Anybody ever see the movie Aaron Brockovich? Yes, no.
I don't
It's
remember.
about a small town in Texas that a large company was dumping hazardous material into the water. And it's a little small town in Texas. Everybody's getting sick, cancers, losing
Yeah.
pregnancies from contaminated water. That's a really good movie that really outlines what environmental risk disaster is. There was a water disaster, Flint, Michigan, from several years ago with the water contamination. You remember that?
Remember that.
So, okay. Guys are quiet today. Okay, let's talk about learning. Okay, as nurses, all we do is teach. It's one of the most important roles as a nurse. Why do we teach? Promote health, prevent injuries, illness, improve healthy behaviors. Right? We know that education, the more educated you are, the more empowered you are. Right? We educate in every area of nursing we're in. Doesn't matter if you're in home, doesn't matter if you're community nursing, hospital nursing, bedside nursing, we're always teaching. One of the biggest barriers to learning is health literacy, low health literacy, biggest barrier. And that was part of one of our quiz questions. Okay, low health literacy can impact everything from the patient communicating what's going on when they present to helping them understand their treatment plan, helping them participate in the treatment plan. It's virtually impossible if there's low literacy. Okay, culture. Culture plays an important role in another barrier to learning. Right? That's why we need to understand, we've talked about this before, understanding different cultures, what their values are, what their beliefs are, what their practices are. We have to take that into account when we're teaching. And then non-English speaking. Talked about that. Think of the challenges that presents. Like I said earlier, interpreter, that's the best case scenario. But Brian mentioned earlier in one of our quiz questions, how do we communicate with them in their primary language? Pamphlets, maybe radio information in their primary language, news information in their primary language. You know, how are you going to teach? How are you going to teach a family that speaks, let's say, Russian, and they have an ill child, or they have a child that has conjunctivitis or head lice? I'll speak for what I needed to do in the schools, or scabies, something in the schools, and they're only Russian speaking. What do I do? How do I communicate and teach, help that parent understand what you have to do for scabies, what you have to do with conjunctivitis? If an interpreter wasn't available, we had literature in several primary languages, right? Native languages that you can provide them. So low health literacy, understanding what's wrong with them, treatment plan, culture plays a part, language plays a part. Okay? The other things to think about as far as potential barriers, are they ready to learn? Motivation. Again, culture and values. What are their personal expectations and experiences? Maybe they have a lack of self-confidence. And always providing support and praise and encouraging. So I pose this to you. Let's say you're working in the rural setting where we know that clients don't take their primary care seriously or serious. How do you motivate them to have them understand the significance of their new diagnosis, or their significance of their injury, or their significance? How do you motivate them to participate in their follow-up? What if they had an injury? How do you motivate them to continue on their recovery? Right? More so in the rural community, but let's say in the big urban community. How do you assess their readiness to learn? How do you motivate them? How do you bring their culture and values into whatever the plan is? Whatever you're trying to teach them. How do you communicate the significance of, you just had a heart attack, here's what you need to do to follow up. You just had pesticide exposures. Okay, you're showing signs of pesticide exposure, you're at the urgent care. How do we convey the significance of that? How do we assess their level of confidence? A lot of barriers to learning. And I'm sure in your current roles, if you're working, I'm sure in your current roles, you already have had these challenges. Some different ways people learn: visual, auditory, kinesthetic is doing. So visual, you learn by seeing things. Auditory, hearing things. Kinesthetic, doing things. That's that teach-back method, the hands-on. And then there's some domains. We all have domains of learning. We all have a cognitive domain, affective domain, and psychomotor domain. Okay, cognitive. We all possess all of these, but usually one is more so than the other. For me, I'm a psychomotor learner. I'm hands-on. Okay, cognitive, the thinking part, right? Your ability to hear the information, understand it, and use that to problem solve. So it's the thinking part. Affective is the feeling part. Okay, what is your group's attitudes and feelings and beliefs and values about what you're trying to teach? You know, what if you're trying to teach in the rural community and they're just not motivated? They don't really care, right? Unless there's something really wrong with them, they're just not motivated to learn. Okay, how does that affect their ability to learn? What if you're attending a teaching workshop or something, or what if you're teaching a workshop where you have your group, they're just not into it, right? For whatever reason, right? They want to get done real quick so they can get home, or they don't really have, maybe it's a cultural issue. They don't really believe in what you're teaching, right? That's that feeling part. And then the psychomotor is the doing, right? So you're learning through practice and experience. Those are your quiz questions about helping the diabetic learn to test their blood sugar or give their insulin injections. That's a psychomotor. So know these three, because there's a couple of questions on the exam about the difference between these three. Be able to put a scenario, read a scenario. Is it a cognitive? Are they approaching this with cognitive, affective, psychomotor? Okay. This is important here. If education doesn't address all three domains, you'll not be nearly as effective. Telling someone to change without motivating them to do so or providing them with the skills is not effective. Okay. How do you reinforce health education? Let's say to reinforce health education, right? You have to have, it can't be your idea. It has to have a collaborative effort. You have to collaborate with the people that you're trying to teach, right? Let's say you're in the hospital, you have to collaborate with the patient and the staff to develop a patient education plan. That's that question about, do we do it on our terms or their terms, right? You're not going to get a lot of buy-in to whatever you're trying to teach if this is on your terms, right? You have to, that old saying, you have to know your room, know the room, right? Know the age group, know the ethnicity, know the beliefs, maybe know the values, the cultures, the motivation. Yeah. What if you have clients in a group that are hearing impaired or visually impaired? How do you make adjustments to reach them? Right? How do you assess their literacy level? How do you assess their language level if maybe English is second language? Okay. And that all goes into play when we're talking about any kind of patient education, any kind of discharge planning. So here's some examples of primary, secondary, and tertiary with regards to education. Maybe primary, here's some examples. Teaching women to go to the bathroom before and after sex to prevent cystitis. Teaching parents how to role model healthy eating. Educating parents on immunization. Okay, and the importance of immunization. Maybe a secondary prevention, right? Screening. Maybe teaching an elderly woman the signs and symptoms of a UTI. How do they self-screen for that? Helping clients prepare for a colonoscopy. Giving a pamphlet on the importance of scheduling pap smears or mammograms. And then some tertiary, they already have something. Diagnosis, condition, injury. Maybe we're teaching a low sodium diet to people with hypertension. Maybe we're working with people that have diabetes on how to use the glucometer. Okay, maybe they're on new medications. Okay, so maybe we're working through discussing the potential side effects of new medications. Okay. So learning has not occurred until the behavior is changed, right? Behavioral changes are hard. Does anybody work with anybody? I don't know if I've said this before. Does anybody work with anybody that would just prefer to do it the old way? Anybody work with people like that? They're just very resistant to change. That's not that uncommon. But we have to work with those people if there are better ways, better best practices on how to do things. Change is hard. right? So nobody works with anybody that doesn't want to change. Okay.
Yes, I work with
okay.
a lot of older people and they don't want to change anything.
Anything, right? It doesn't matter if it's best practices, if it doesn't matter. It doesn't matter what the new and upcoming way to do things. They've determined better, updated ways to do things that has better patient outcomes.
And
It's hard.
sometimes,
It's hard.
sometimes the patients don't want to change because they've
Exactly.
done it one way so long with
Right.
those nurses and they don't want it hard.
Yep. Have you
Right.
guys participated in education opportunities in which you really weren't into the subject that was being taught, but you had to go? Anybody
Yeah.
participated in those kinds of things?
Yeah.
Are you less motivated to learn if you're not into it? So put yourself in the patient's position. Education is hard. Well, education itself is not hard. We do it for many reasons, but engaging who you're trying to teach about what subject, whether it's a patient you're trying to discharge home, or whether it's you're a home health nurse trying to teach about new medication, or you've done a safety environmental assessment in their home and realize there's lots of risks. And now you need to teach them or educate them on what needs to change so there maybe is less risk. Maybe there's rugs all over the place. Maybe there's furniture all over the place. You do the assessment that they have lots of risks. How do you educate them? You know, when their houses look like this for 50 years, how do you educate them on the risks? Right? But we do tons of education. We're always educating. I mean, you're probably I know for me, your nurses are the go-to, right? Whether it's at school, at work, at the grocery store, your neighbors, your relatives, everybody's always asking nurses what to do, right? We're that person, we're that go-to person. So we're always educating, whether it's in formal settings, informal settings. How do you know your audience? How do you be most productive? It's hard. So I'm going to break you guys out into 3 breakout rooms. It's a case study about health education in the community. Let's see how you do. All right, so 3 breakout rooms. Somebody needs to pull up the case study on your computer. In each group, it's in your announcement. And then we'll go to a breakout room for a little bit, and then we'll come back and we'll talk about it. It's just reinforcing what we've just talked about. Does anybody have any questions? Okay. It's hard when you guys are quiet, just for the record. It's hard. It's hard. I hope you're taking it all in. I know you're not
Yes.
asking questions, but I hope you're taking it all in.
We're absorbing. Yes.
You're absorbing. Got it. Got it.
It
Okay.
won't let me pull up the case study. It's telling me access denied.
Same.
Okay. So here's what I'm going to do. I have the case study pulled up here. Everybody see that?
Yes.
I'm trying to think of, I don't think I can copy and paste it in the, let's see.
I printed it, but I wrote all over it.
Okay, Charlene, so you've printed it. Did anybody else print it? Okay, I'm going to put you into groups, and I'm going to, if you're in group 1, I want you to answer question 1, 2, and 3. I'm going to, I know what I'm going to do here. Can anybody pull it up?
See if I can get it. Announcement.
Could you guys all try, please? I've heard from 2 people they can't. Can anybody pull it up?
Is it in week?
It's week 6.
I
The
tried
announcement I
pulling it
sent
up, but
yesterday.
it won't let me pull it up.
Okay, is this for everybody?
I got it.
I got it on my announcements.
I
Can you
got on
open
my-
it?
Yes.
Oh. Okay. All right, so Charmaine, I'll put you in a different group. Cindy, you can see it. And who else? Anybody else can see it? Casey says no. Do I have any yeses?
No, it's saying unauthorized, so it's not allowing us to open the folder.
All right. I'm going to. Student case study. All right. I'm going into your announcements. Week 6, case study. I just put it in your announcement. See if you can open it now. Maria's shaking her head. Amara, yes?
Yes.
I
Okay,
got it.
great. All right, I'm gonna guys put you in breakout rooms. Okay, so group 1, answer question 1, group 2, answer question 2, group 3, answer question 3. All righty. Okay. There you go. See you in a minute. Rafita, you gonna join your group? Vanessa? Vanessa, you there? Vanessa?
I thought you meant like you been when I got that iPad.
Did you guys get to discuss it? Thanks, Clarinda. Let's wait till everybody gets back and review this. When I send the recording for this class, I'll also send the instructor version that we're going to go through the case study. It has the answers and the rationales. And you all, you all know how I feel about rationales. Great way to learn. Okay.
Destiny, mute your camera.
Somebody needs to mute. Thanks, Amar. All right. Can everybody see my screen? Yes? No? Okay. So we have a school nurse providing education to students, parents, faculty with the intent of providing individuals and groups with the tools to make informed decisions about their healthcare needs. We know that healthcare education in the schools is aimed at promoting healthy habits, lifestyles, preventing illnesses, and teaching measures to identify problems at an early age. It's an important factor in this process is for the nurse to set examples in terms of weight management, physical activity, lifestyle choices. That's a good overview of some of the roles the school nurse has in education. So we have Robert Miller. He's working in an elementary setting. What is one of the first steps in creating an effective educational program for students at his school? So group one, room one, did you select answer C?
Yes.
Yes.
You did,
Yes.
right? Because think about it. You have to identify the needs of the population first before you can put any program together, right? So one of the core public health principles is asking learners to participate in identifying what their needs are. And that goes true with really a community. Let's say you're the community health nurse. You have to identify, and you've done your community assessment of what the needs are of the community. Right? First, you have to do an assessment of what the needs are. So Robert then designs education programs to meet the needs or the problems in that population. So for me in the schools, my education for the preschoolers was different from the elementary school, was different in the middle school, and different in high school. Because everybody has different needs. Right? So we're involving education of the individual members of the population about health promotion, illness prevention and treatment. Whether you're in the schools, whether you're in the workplace, the occupational nurse, the environmental health nurse, the school nurse, even the home health nurse, right? Okay, room 2. Mr. Miller creates an educational program for second graders. His topic is related to exercise and fitness. What would be an appropriate educational objective? Did you guys come up with C? Anybody in room 2?
Yes, we did. We came up with
Okay.
C.
You did. There you
We
go.
did.
Excellent job. Right? So this rationale is important about program planning. Really important. Okay? It talks about the difference between objectives and goals. Okay? Objectives, specific. As you're learning about the nursing process, going through your nursing program, this should be pretty familiar to you. Objectives are specific short-term criteria that are met as steps toward achieving the long-term goals, right? So you've identified your long-term goal, you have to have objectives to get there, right? So within 2 weeks, each of the kids will be able to demonstrate at least 2 exercises they've learned, right? So objectives, written statements of an intended outcome or expected behavior change. Okay? So that's why the answer is C. Okay? Everybody understand that? Difference between objectives, you set your goal and then you have objectives to meet that goal. Okay, and question room 3. He's educating the children about health promotion activities. But guess what? He's obese and takes frequent smoke breaks. So now we're talking about educator learning barriers. So my barriers, right? The educator's barriers. Okay, which of the following might be an educated related barrier? Hopefully you come up with A. Right? Did you guys come up with A?
Yes, we came up with A. It was more so we said the children wouldn't be able to trust him because he's obese and he's smoking cigarettes. So that's something that
Right.
shouldn't do as an educator.
Right. It's like me trying to teach this class and I'm an ER nurse, right? With no community or public health experience, right? So it's a lack of credibility with respect to a certain topic. If he's teaching about health promotion activities, it's a lack of credibility, right? And that lack of credibility is often a common educated related barrier, right? So as we educate our clients, we need to make sure we know what we're talking about. We're educated on the subject we're teaching about. We've done our research, we've done our preparation, we know our audience, we know what challenges might be presented. We know our patient. We know our patient and their family. And we can maybe anticipate some of the barriers. Okay? We lead by example. Okay? Helpful case study? Okay. Okay, so that concludes our class for today. We went through all the things to communicate with me at the beginning of class if you need some help. I hope you guys have a good rest of the week. And that completes our content for exam 2. Last week was weeks 4 and 5, and this week was week 6. And that's what exam 2 next week is going to be on, 4, 5, and 6. All right, so
Miss
fill
Martha,
in.
can I speak with you after class?
What?
May I speak with you after class, please?
Yeah, of course.
Thank you.
So I sent you at the beginning in your week 4 announcement, your study guide with all the concepts listed. Hopefully, you're taking notes somewhere. If you're taking notes on the study guide, great. you're taking notes in your PowerPoint, make sure you transfer them over onto your study guide. Okay? And then that's what I'll be taking a look, I'll be going through in my review on Friday. Okay? So I hope you guys, does anybody have any general questions that would benefit the whole group? If not, I hope you guys have a good rest of the day and a good week. If anybody wants to stay on with specific questions, I'm happy to stay on. So have a good week, okay? Good to see everybody.
You too.
All right?
Thank you.
All righty.
Thank you.